All right, so please first rise for the salute to the flag. Good evening and welcome to the July meeting of the Revere Board of Health. My name is Drew Bunker, Chair of the Revere Board of Health. Joining me tonight for tonight's meetings are board members Craig Costanza, board member Neza Luadi, who's joining through Zoom. And then for tonight's meeting are the City of Revere staff, Lauren Buck, who's the Director of Public Health, Michael Wells, who's Director of Municipal Inspections, Health Agent, and Paula Sepulveda, who is the Board of Health Clerk. Also in attendance tonight is the Regional Epidemiologist, Anne Marie Kissel, and then from the Six City Tobacco Initiative, Bonnie Carroll, and from the Massachusetts Municipal Association, Lisa Stevens Goodnight. So tonight's agenda is first to review and approve the minutes from July 23rd, 2022 meeting. So I'm just going to say that to the other board members. So do you approve of the minutes from last meeting? Neza, I can't hear you.
Yes, I approve the meeting,
okay.
The hours.
Thank you. All right, next is the Public Health Communicable Monthly Report from Lauren Buck.
Great, thank you. So I'm going to direct our attention for the July 22 Public Health and Communicable Disease Monthly Report to two specific communicable diseases. One is monkeypox, which I talked about last meeting. To give you an update, to date, Revere has had actually 3, since writing this report, confirmed cases of monkeypox. All cases have been part of the high-risk group that we've seen primarily targeted in this specific outbreak, which is men who have sex with men. All cases are doing well. One has completely recovered and been cleared to leave isolation. The Revere Board of Health is the body that decides when cases are allowed to leave isolation, and we continue to be in contact with the other cases as well as the Massachusetts Department of Public Health. And so all cases have been monitored by both parties. The other specific communicable disease that I wanted to bring to your attention, we had one case of Vibrio. I wanted to just kind of do some education around this. So Vibrio Hemolyticus is a bacterial infection that is found in seawater. It is an emergently reported disease in the summer months when there is an increase in water activity by residents and water temperatures increase. The water temperatures increasing also cause bacterial levels to increase for this specific bacteria. Many times our infections are caused by ingesting raw seafood, or if someone enters water with Vibrio bacteria, with an open wound on their foot or something like that. Common symptoms are gastrointestinal in nature. And I can report that the confirmed case from Revere from last month didn't result from any known seafood or shellfish sources in any of our restaurants or anything like that. We still have a current TB case doing well on treatment. And then I'll just quickly talk about COVID. So I wrote this report about two weeks ago. As of 2 weeks ago, we had 23,803 confirmed cases. Our total deceased as of July 13th was 186. And our 14-day positivity rate was 7.59. In the last 2 weeks, our positivity rate has actually increased to about 9.6%. Just something to keep an eye on, because we know that positivity rate is a significant undercount because most people are testing using at-home test kits, which do not get reported in this specific positivity rate. So it's just something to think about as the summer moves on. And then I always put in our percentage of Revere residents that are fully vaccinated. As last month I reported, in almost every age group, our vaccination rates are increasing. Obviously, we'd love to see that 5 to 11 increase, past halfway, to get up into the 60s, especially as school comes back in August. We do continue to have weekly vaccine clinics. And just one note, obviously, the 6-month-old to 5-year-old range has been approved. I'm sure you all know that from the news. but there isn't any data on that age group yet. So when there is, I will report that for you. We are expecting, and the trends are that many parents with kids in that age group are a little hesitant to get vaccinated. And so I expect that our numbers will be reflective of that national trend as well. And so that's all I have for you for the communicable monthly report.
Great, thank you. Next is going to be the Inspectional Services Monthly Report, and that's from Michael Wells.
Thank you, Dr. Bunker. As of July 27th, Municipal Inspections Monthly Report for our Interior Housing Division, we performed 54 inspections for a certificate of fitness, which is human habitability of an apartment. We did 8 re-inspections for certificate of fitnesses. We had 18 interior complaints reported to us from tenants, 7 re-inspections for interior complaints. We did 2 pool inspections and 3 re-inspections for pools. And we did 2 inspections on lodging houses, re-inspections. On the food inspection division, we had 20 routine inspections of our food establishments. We had 13 re-inspections. A re-inspection occurs when there are critical violations found in an establishment to ensure that the violations have been corrected. We had 7 complaint inspections, 2 pre-opening inspections of new establishments coming into the city, and we had 26 temporary food inspections, which was all of the sandcastle vendors this past weekend down on Revere Beach. As far as our exterior sanitation division, we had 48 violations of accumulation of litter and garbage and trash. We had 24 of improper bulky item and yard waste placements, 199 improper placements of garbage and trash, 2 improper signage. Violations are given for improper signage if signage is posted on telephone poles or any public property for yard sales, garage sales, estate sales, or anything to that sort. We had 5 violations of improper trash storage, 15 junk heaps, automobiles parked on property in violation, whether it's on grass or in the rear of a property. We had 2 violations in regards to rodents, 50 violations of unclean, unsanitary, or overgrown vegetation on properties, and 3 unpermitted dumpsters. We also issued 11 violations this past month of contractors or residents doing work on their property without proper permitting. And that concludes the monthly report for inspectional services.
Great, thank you, Michael. So next is going to be the presentation on results of the Community Health Needs Assessment, and I'm going to turn it over to Anne Marie Kessel for that.
Thank you. Just one moment as I set up my, all right. Great, can you see that okay?
Yes.
Okay, great. So good evening, everyone. My name is Ann Kissel, and I'm the Regional Epidemiologist for the North Suffolk Public Health Collaborative. And the position is contracted through the Metropolitan Area Planning Council, and it specifically serves Chelsea, Revere, and Winthrop. I've been working closely with Lauren Buck in Revere's Public Health Department, and she asked that I present to you all some of the materials that I've been working on related to the recent Community Health Needs Assessment. Aside from COVID-19 response, as well as other disease surveillance and initiatives, the collaborative also assists in the Community Health Needs Assessment process, and today I'll be presenting some of the preliminary or primary findings that we've accumulated thus far. So just a bit of background on the community health needs assessment. So the assessment aims to collect community perceptions of health and needs within the region in a very systematic way to identify key issues and develop a community health implementation plan, otherwise known as CHIP, to address these identified health concerns. Nonprofit hospitals are required to complete a community health needs assessment and develop a community health implementation plan, otherwise known as CHIP, as I mentioned, to address these needs every 3 years. Some of the current partnerships that we work with are with Beth Israel Lahey Health, MGH, and CHA. We've utilized the Thrive framework, which is located here, during the 2022 Community Health Needs Assessment to focus on structural drivers of health. In this framework, in order to understand structural drivers of health, such as racism and how these play out in community levels in terms of social and cultural, physical or built, and economic or educational environments, referring to these community level indicators as community determinants of health. So this is a flow chart of the process of the community health needs assessment, beginning with the analysis of secondary data, as well as survey data and qualitative data from focus groups. This information is then presented to the steering committee for feedback, which is right here, and then presented to the individual working groups for additional feedback on our 4 key priority areas of environmental health, housing, economic opportunity, and behavioral health. Currently, we're at this stage in the process of collaborating with these working groups. So we haven't reached this latter half of the flow chart with communicating the full report and implementation plan back to the community yet. However, we plan to do that during this coming fall. So this is the process of the survey analysis that we've completed thus far for all of the quantitative survey data. So first, if we start up here, the survey collection started in October of 2021 to February of 2022. And then we analyzed preliminary findings and presented them to the steering committee in February of 2022. And then we stratified the findings by municipality for all of the 269 variables that were collected. For the entire survey, there are 1,401 respondents. There were 191 who identified living in Winthrop, and then 493 from Chelsea, and then from Revere, 717. And Revere made up majority of these respondents at 51.2%. So now we're at this process of really looking deeper into priority areas and how we can dive deeper into that data that really leverages health equity and actionable public health initiatives while utilizing insights from secondary data. And today I'll be focusing on those 4 priority areas specific to Revere. So these are the priorities that were determined by the 2019 Community Health Needs Assessment, which, again, as a reminder, happens every 3 years. So we have housing, environmental health, economic stability and mobility, and behavioral health. Okay, so these are the top health concerns from past community health needs assessments. So if we start at the bottom here, these are the results from the 2015 survey. Now, if we look at Revere in this pinkish color, the top 5 reported health concerns from community members were alcohol, drug use, addiction, and overdose. Second, we have crime and violence, mental health, environment, and then poor diet and inactivity. In 2019, those health concerns shifted a bit, which is right here, again in this pinkish color, which were alcohol, drug use, addiction, overdose. mental health, environment, housing, and poverty. All right, so in 2022, this question was framed a bit differently, but instead of asking for the top health concerns, we then asked for the most important things that you would like to improve about your community. Respondents were allowed to select up to 5 from the following list. And here I've highlighted in red the top 5 improvements in the community. Those being better access to healthcare, better schools, cleaner environment, lower crime and violence, and more affordable housing. Okay, so let's start from priority number 1, which is housing. So 69.5% of Revere respondents reported more affordable housing as the most important thing that they would like to improve about their community. Respondents were asked how true the following statement is. Housing in my community is affordable for people like me. Majority of Revere respondents, 51.5%, selected not true at all, which is here on the left portion of the slide. Additionally, respondents were asked how true the following statement is. People like me have housing that is safe and good quality. Majority of Revere respondents selected true at 61.6%, which is here on the right side of the slide. Moving on to priority number 2, environmental health. 25.8% of Revere respondents reported a cleaner environment as the most important thing that they would like to improve about their community. Respondents were also asked how true the following statement is. The air in my community is healthy to breathe. Majority of Revere respondents selected true or sometimes true. Respondents were also asked how true the following statement is. People like me have access to safe, clean parks and open spaces. Majority of Revere respondents reported true or sometimes true. A bit more on environmental health. Respondents were asked how true the following statement is. On the left here, quote, during extreme heat, people like me have access to options for staying cool. Majority of Revere respondents reported that being true or sometimes true. And here on the left, they were asked how true the following statement is. The water in my community is safe to drink. Majority of Revere respondents reported true or sometimes true. Okay, moving on to priority number 3, economic stability and mobility. So respondents were asked how true the following statement is. Quote, people like me have access to good local jobs with living wages and benefits. Majority of Revere respondents selected not true at all at 44.2%. Respondents were then asked how true the following statement is. Quote, people like me have access to local investment opportunities such as owning homes or businesses. Majority of Revere respondents reported not true at all at 44.8%. So here is some secondary data in the 2 bar graphs from other data resources, specifically the American Community Survey, facilitated by the US Census. So if we look at this first graph on the top left, it demonstrates the percent of population in poverty, which was determined as 12% in Revere, which is higher than the overall Massachusetts proportion at 10%. We look at the second bar graph on the lower right-hand side of the slide. We see per capita income between 2016 and 2020. Revere is listed as $30,591 for per capita income, which is lower than the overall Massachusetts per capita income at $45,555. 23.4% of survey respondents, of Revere survey respondents, reported that better access to good jobs was the most important thing that they would like to improve about their community. Also, in this bottom left-hand box, this is findings that we've found from the qualitative aspect of this process. So multiple focus group member participants emphasize the importance of receiving fair pay and having access to safe work environments. Participants highlighted that economic stability would help alleviate multiple health issues. One participant stated, quote, "If they have access to good jobs that are well paid, their mental health, food insecurity, and affordable health improve." Okay, and so moving on to our last priority, which is behavioral health. 32.8% of Revere respondents reported that better access to healthcare was the most important thing that they would like to improve about their community. Survey participants were also asked in the last 12 months, did they ever need mental health care? Majority of respondents, 54.3%, reported that they did not need this type of care, which is demonstrated here in this pie graph. But then 18.7% of folks reported that they needed this type of care but could not access it. If we look at the the right side of this slide, this is some additional secondary data from the Massachusetts Acute Hospital Case Mix database, which demonstrates the age-adjusted mental health hospitalization rates per 100,000, which in Revere is 965.9 per 100,000, which is lower than the overall Massachusetts rate at 989.8. All right, sticking with behavioral health, participants were also asked in the last 12 months, did you ever need emergency care for mental health crisis, including suicidal thoughts? Majority of participants reported that they did not need this type of care. However, if we look at the darker portion of this pie graph, 13.9% selected that they needed this type of care but could not access it. 18.2% reported that they needed this type of care and was able to access it. If we look to the right, this is, again, secondary data from the Massachusetts Acute Hospital Case Mix data set, where we see that in Revere, for age-adjusted mental health emergency department rates per 100,000, that Revere had a rate of 3,056.5, which is higher than the overall Massachusetts rate, which was 2,807.7. Sticking with behavioral health, survey participants were also asked in the last 12 months, did you ever need care for substance use disorder? Majority of participants stated that they did not need this type of care at 70.4%. However, again, if we look at this darker portion of the pie graph, we see that 12.3% stated that they needed this care but could not access it. And then 17.3% stated that they needed this type of care and was able to access it. If we look on the right-hand side, we see that this is a graph, again, from state database demonstrating the non-fatal unintentional poisonings and overdoses hospitalization rates per 100,000 between 2016 and 2019. And we see here for Revere, that rate was 54.8 per 100,000, which is higher than overall Massachusetts rate at 46.9. Here at the bottom, on the left-hand side is another qualitative finding from a focus group. Revere and Winthrop youth discussed that increase in vaping, particularly in school bathrooms. Youth in Revere noted that vaping is increasing among freshmen. The increase in vaping has negatively affected the ability to use school bathrooms as youth are occupying the stalls to use vapes. The youth stated that vaping is unhealthy because of the smell and the smoke in the lungs. Okay, so this is the end of my presentation, and I really want to thank you all for your time and attention. I know that was a lot of data that I just threw your way, so I appreciate your attention. But I just wanted to list out the overall priority areas again that we continue to focus on as the key needs in North Suffolk communities based on the analysis of past community health needs assessments in 2019. And so we continue to focus on and lift these needs, specifically housing, environmental health, economic stability and mobility, and behavioral health. I'm happy to open the floor to any questions or comments. And I've also included my information here at the bottom left-hand corner of the slide in case anyone would like to reach out after the meeting. Thank you.
Thank you, Anne Marie. That was excellent. Very informative. Does anyone have any questions or comments?
I just want to say thanks, Anne. I know we've chatted a lot, both of us, and thanks for coming to present. And hopefully we'll have you come back quarterly to talk more about all your work. So thank you.
I would love that. Thanks for having me.
Great. So the next point of the agenda is going to be the public hearing and the review of proposed amendments to regulation restricting the sale of tobacco and vape products.
Okay, thank you, Dr. Bunker. So I'm going to help facilitate this portion of the meeting, just so everyone has a good background on where we are. The City of Revere currently has regulations for the restriction of the sale of tobacco products. Our current regulations were signed in 2019. Since that time, there have been many changes at the state level that need to be addressed in our regulations in order to make everything cohesive. So before the board are proposed, a draft of proposed regulations that we would like to discuss tonight. The format of this will be, we will be discussing some of the changes, but we will present you a formalized version of the regulations at the next meeting for you to actually vote on. So we're going to be talking through some of the changes tonight. We will make notes of the things that you want to include in the final regulations, and then we will present them to you in August. One other note for the group and for people listening at home. Our current regulations are kind of so out of date that there are many things in the regulations that reflect updated state laws that the city level has really no say in terms of making decisions on. But that updated language is reflective in the new regulations. But we will not be talking about every single point that is different from the current regulations, or else we'd be here for 3 nights. So what we will be discussing are the components of the regulations that you as a board have a say in and can decide on if the language is included or not. That being said, we also have at the podium Bonnie Carroll, Lisa Stevens-Goodnight, who have been instrumental in helping us kind of get these regulations in order and actually have a lot of knowledge that will help you make a decision, hopefully, in what we want to include here in Revere. So I'd like to get started, and we are going to move through the statement of purpose, which is page 1 and 1, 2, 3. And we're going to move right to page 4. This brings up the first kind of component of the regulations in Revere that we have to talk about. And on the top of page 4, you're going to see a highlighted section in blue. That's the definition for a blunt wrap. This would be a new addition. This would be a new definition added to our regulations. The blunt wrap definition and regulations on blunt wrap was not addressed in our previous regulations. I can talk a little bit about that, but I'm also going to have you guys talk a little bit about the importance. Basically, in 2019, there was a lawsuit brought for a specific tobacco retailer. And because of that regulation, there were some things left out of our old regulation. One of them was regulating blunt wraps. We have discussed this with the city solicitor. We've also discussed it with Lisa and Bonnie. Do you guys want to add kind of potentially a little bit more about why, Bonnie, maybe why we think blunt wraps maybe should go into this regulation now and not be left out.
Okay. Well, I actually brought a couple of samples with me to explain one of the reasons that we think this is really important. So here's one of the arguments that I hear all the time about why we should not regulate blunt wraps is because blunt wraps, just to give you a little background, blunt wraps are leaves of tobacco that need to be filled with something in order to smoke them. So in other words, I have one here and I'll show you why this is significant because you can see it says cigar. It's not a cigar, it's a blunt wrap. A cigar can come right out. It's machine rolled and tight together, and you can smoke it immediately. This needs to be filled with something. So when we were initially asking that these be banned, it was because they were being filled with illegal products. And then once cannabis became more legal, people were saying, well, these should be legal because, you know, it's okay to smoke this now. But DJ, Lisa's predecessor, who you've met before, explained it to me one day because I was thinking the same thing, like, why wouldn't we allow these now? Because they're usually used to be filled with cannabis. But here's the reason why, is because these products are made out of tobacco leaves. And so therefore, when someone is using them to smoke cannabis, they're not just getting the cannabis, they're getting tobacco and nicotine. And I just want to show you why we want these to be banned. You can see that people will tell me, especially when I do inspections all the time, oh, that package says it's a cigar, as you can see. But if I open it, and I do this all the time with retailers, I open it and show them, this is a tobacco leaf. It's a tobacco leaf that gets stuffed with something. And here's one of the ways that some of the manufacturers have tried to get around the issue. They stuff it with some loose tobacco, and they say, oh, see, it's a cigar because it has the loose tobacco. But the reason we want you to update the definition of a blunt wrap is so that we are not continuously caught up in that legal language that kind of gives manufacturers the okay to call these cigars, because they're not cigars. So hopefully that's a little bit clearer.
Yeah, and so I would just say, we're going to talk about if blunt wraps are something that we want to regulate and restrict in Revere, the definition inherently has to be put in place in the beginning, but the actual restriction is much later on. So once we get to that part, you can decide if you want to keep the regulation in place, and therefore the definition would have to be in place because we're regulating it.
Okay, so yeah, let's just keep the definition so that we can.
Right,
Yeah.
okay. All right, so let's move on to the next section. We're moving on to page 6, which is another definition. And I'm actually going to defer to Bonnie and Lisa again. We talked a little bit about this, Bonnie, when we were discussing these regulations. It would, again, rolling papers, the definition and the restriction do not currently exist in our old regulation. So this would, again, be a new definition put in place and a new regulation. So I'm going to have Bonnie talk a little bit about why that is important as well.
Okay. The reason is because we want to stop flavors from getting into the hands of young people. And if we allow flavored rolling papers, then we're back to the same issue. So these are flavor enhancement, basically.
And can I just clarify, because I want to make sure that the board understands. So there's a definition for rolling papers, and then there's a separate, on page 7, there's a separate line at the end of the tobacco product flavor enhancer definition that says a rolling paper with characterizing flavor shall be considered a tobacco product flavor enhancer. So I just want to make sure the board understands that they have the ability to decide if they want all rolling papers regulated or just flavored rolling papers regulated. Is that correct?
Yes, I think that one of the reasons that the rolling paper just kind of not blanket, but the broader definition is included is for ease. Regulating the flavored tobacco products is time consuming. So this is something that just if someone is a tobacco retailer and they're trying to sell the rolling papers, just taking them out makes it much easier and is just for cleaner enforcement. But you can just, and also, I mean, people are using them to smoke tobacco, so you do want to regulate them. But, and on top of that, but yes, if you wanted to limit it more, it is possible to do the more limited, just flavors only. But as I said, that does, it can make enforcement a little bit harder.
And can you speak to other cities in the Six City Initiative? Are other cities taking a stance in terms of rolling paper, just so our board has a knowledge of what other cities have been doing?
I'm so sorry, I don't have that information with me. I can get it to you. I have to go and look at their regs. I don't know off the top of my head.
Okay, just so
Sorry.
yeah.
Yeah, I don't know off the top of my head. I have to look it up.
Okay,
But I can get that to you before your next meeting.
great.
I keep a list of all the towns and cities that have enacted different parts of the regulations, and so I have one, and it'll distinguish. It won't just be for the 6 cities, but it'll be for the whole state, and it'll also distinguish which ones have the flavor versus just the rolling paper definition. I can send that to you.
Okay, so just the board understands, you can go more restrictive with our regulations and regulate and essentially ban all rolling papers, or you can be less restrictive and ban flavored rolling papers. That's a decision that you all will have to make. Okay. So I want to move on to page 7, which again was something that we just talked about. This, the green highlighted section, a rolling paper with characterizing flavor shall be considered a tobacco product flavor enhancer. This is exactly what we were just talking about. If you wanted to go the route of only banning flavored, this would be where it would be. Okay. I want to move on to page 8, the last, number 4. It has a green highlighted section. And this is not necessarily something that you have to decide. The language will stay exactly the same, but the meaning behind the language could potentially change. So I'm going to read it out to you. It says, all retail sales of tobacco products as defined herein must be face-to-face between the seller and the buyer and occur at the permitted location. This language is not really that new. It was in our old regulations. The only difference here is that under these new regulations, there are a lot more things that are considered tobacco products as defined herein. For example, potentially blunt wraps, for example, potentially rolling papers, but other things that are new that are in state law as well. But there's just a lot more things that are defined as tobacco products. Can you just verify that that is correct?
Yeah, so one of the big things that we've been seeing since the flavor ban came in is these things called flavor product enhancers, and I'm sure Bonnie can speak more to this because she does the kind of day-to-day enforcement, but it's basically products that are sold next to tobacco products or, at the front kiosk where tobacco products are sold, and they're used to kind of get around that flavor ban. So I think there's like cards that you put into a cigarette pack, things like that. And so that's including products. That's the expansion that includes those, even though they themselves do not have tobacco. They are being used for when people are using tobacco products.
Right, so go ahead, Bonnie. Okay.
Sorry, Lauren, I'll just mention one more thing if I could. So there's an emerging product that I'm finding in a lot of the stores. It's called Natty Hemp Wraps, and they're made out of hemp, but they're mostly flavored. And the flavored ones, again, are used as a flavor enhancer. So that's why we would ask you about that too.
Yeah, so that's why, again, with these new regulations, we want to make our regulations as cohesive with the other cities, as Bonnie inspects many cities that were part of Six City Initiative, but also reflective of the new laws that are in the state and reflective of the new products that are out there. So that's really what this wording is about. It's not necessarily that you have to decide that this wording has to stay, but the fact that it represents more and more products under its kind of umbrella. Okay. So page 9, I want to talk a little bit about the first highlighted word, which is where you potentially, again, you would need to decide if you want to include this word in our regulations. I'm going to just go to the beginning of the paragraph where the highlighted word is in. Only owners of establishments with a permanent indoor, non-mobile location in Revere are eligible to apply for a permit and sell tobacco products as defined herein, at the specified location in Revere. So I talked to Bonnie and Lisa about why the word indoor is a new addition, and they explained to me that some cities were seeing that people were potentially selling tobacco in like food truck pop-up type locations, mobile things. And so this, putting the word indoor in here, makes it very clear that any tobacco sales product permit has to be associated with a storefront, brick and mortar. It cannot be a truck going around selling tobacco. Correct, yes?
Yeah, so I took over from DJ, who did this job for 30 years, and he could tell you the exact story behind this indoor inclusion. I do not know it, and he broke his wrist recently, so his typing is a little, emailing him is a little hard right now. But yeah, so this is basically just in there because someone was trying to get around the rules. I think it was kind of like a walk-up, like, window sales type of thing. So it's just to kind of tighten things up, to make sure people are selling them in stores. And that's particularly important when it comes to minors getting access to tobacco, because you really want to make sure that they're in a place that is like a kind of controlled environment, and that they're able to ask for ID, that they're able to kind of do the whole transaction that way.
So just so the board can, verbalize, unless there's an objection, we will be including indoor in the final regulations that you vote on next month.
Yeah, that sounds appropriate.
Okay.
We can vote on that, but that, for now, let's leave that in.
Okay. So moving on to the next highlighted section. Again, there's not much to really to decide on here, but it does reflect the fact that, there's changing federal, state, and local laws. So the sentence reads, each applicant is required to sign a statement declaring that the applicant has read said regulation and that the applicant is responsible for instructing any and all employees who will be responsible for tobacco product sales regarding federal, state, and local laws about the sale of tobacco and this regulation. The phrase federal, state, and local laws is highlighted in green. Again, just to reflect the fact that there are many levels of laws regulating tobacco and that they need to be aware of all of them. Correct, Lisa?
Yeah, it's just to kind of make sure that when there are updates to the state and federal laws, as we've seen, there can be pretty significant changes, that they're keeping their clerks and themselves up to date on those and continuing to enforce them.
Mm-hmm. This is one of the things that I do a lot of education about, because lots of people don't understand that, the ladder of how the laws are made. So it's important to have it in there, I think.
And I'll also say that there are tons of resources, so this is not something that you're putting in and then kind of leaving store owners to have to figure out federal, state, and local laws. I mean, that's, we provide resources, the Massachusetts Clearinghouse provides resources, so there's lots of training information available. So it's not as if they're gonna have to be calling a lawyer every time they hire someone to explain tobacco laws to them.
Great. And so unless there's any objection, we will also be including that phrase in the regulations that you vote on next month. I just want to, something that is not highlighted in paragraph number 4, our permit schedule is on December 31st. It previously was on May 31st in the old regulations. I updated, as per Mike, in Citizen Serve, our permits are renewed December 31st. Again, that's just a clerical thing. You don't have to vote on that. Moving on. Okay. So the next highlighted section at the very bottom of page 9, this would be a new addition to our regulations. It states, as of the effective date of this regulation, no new adult-only retail tobacco stores shall be located within 25 feet of an existing retailer with a tobacco product sales permit. No single retail establishment shall have more than one tobacco product sales permit. Again, I'm going to actually defer to Bonnie and Lisa about the specifics of this, but it is restricting this regulation, part of the regulation, this wording, is only talking about adult-only retail tobacco stores. There's a difference between an adult-only tobacco retail store and a store that sells tobacco products. An adult-only tobacco retail store only sells tobacco. And so the regulations on them are a little bit more strict. Is that correct, Lisa?
Yeah, so they can also sell a wider variety of products. Generally, they can sell kind of the higher concentration nicotine, And so what this really does is it makes it so that if somebody is a tobacco retailer and they wanted to, say, open like another, like a shed that was an adult-only retail store on the property, it would have to be more than 25 feet away. It basically can't be attached to the other, to the place that has the other permit. And that's just, a big part of that is just to, because you also have to have an ID in order to access the adult-only tobacco retailers, because they sell those higher, just to like even go in the door, because they sell those higher concentration products. And so the aim is to make sure that there isn't kind of intermingling between the people that, like you're not going in to get a soda at 17 and then like wandering your way into a place where you can buy these higher content tobacco products.
And again, unless there's any objection, we will include this in the regulations to be voted on in August. Okay.
Oh, and I would just add that the idea about that they can only have one tobacco permit. I'm so sorry. The one tobacco permit speaks to that as well. They can't have two different kinds of premises. One permit, one store. That's it. Yeah.
Okay. So the next section that we're going to talk about is on page 10. It's section 11, maximum number of tobacco product sales permits. Here's where you are going to have a choice of the way that you want to go in Revere. And I'll do my best to explain this, and if I'm messing this up, please jump in. There's 3 possible options that you all can take in terms of the number of tobacco sales product permits that we have in Revere. The first option is called a basic cap, essentially, which means that we currently have 60 tobacco permits. We'll always have 60 tobacco permits. And if one retailer decides that they don't want to sell tobacco, they give their tobacco permit up, and there's a wait list essentially for retailers who would want that permit, and they can come in and you pick the first name off the wait list and they get that tobacco permit. And if we choose part A, which is the basic cap, there is not a diminishing number of permits. It stays at 60, essentially. Correct? I'm good so far?
Correct.
Okay. The other option that you have is called an advanced cap, which I believe Winthrop has adopted, correct, Bonnie?
Yes,
Okay. This is a diminishing number of permits as the years go on. And the way that happens is there's a set number of permits when the regulations are enacted. Any tobacco retailer that then gives up their permit after these regulations are enacted, that permit essentially is gotten rid of. I could think of a better word, but gotten rid of. And then the number goes to 59. And the next time a retailer wants to get rid of a permit, they get rid of that permit, and then the number goes to 58. And so there's an ever dwindling number of permits for a city. The theory behind this is essentially to try to continue to reduce the number of tobacco retailers in a city. That's the second option. I'm good so far?
Yeah, I would just add that you can, if you buy, so under the advanced cap, if someone were to buy an existing tobacco retailer, they could also purchase that license. So it would be as if somebody turned in their license and said that they didn't, or their permit, they didn't want to sell tobacco anymore, or they were closing down their shop permanently and not selling it to someone else. But if someone were to purchase it, they could. So it's a slower way, but it does over time reduce the number of retail establishments.
Right. And then the last option is kind of like, and this is where I'm going to have you guys help me the most. It's kind of a mix. It's called a dual cap, which, if I understand correctly, the dwindling cap applies to adult-only retail stores. Is that correct?
No.
Oh, okay. Correct me if I'm wrong about that.
So, yeah, so you can, I guess you could apply it to that, but no, it generally applies to both of them. And what it does, and it is a little bit more complicated, and it doesn't exist in as many towns, is that it also does this thing that your permit would, if you fail to renew your permit within 30 days, I don't know if that's something that happens commonly here. I know in some towns, there are people that wait a very extended amount of time. But basically, if you don't renew it in that 30-day period, you get treated like a first-time permit. So you would, if you have the basic cap, what would happen is that you would, they would have to go onto that wait list. And then their permit would also open up for somebody else, because they would just go to the wait list. And then if you have the reducing cap, that would be a forfeited.
I didn't
Yeah.
understand that, thank you, yeah. Okay.
So it really makes it so that they are renewing within that 30-day period. And as I said, there aren't as many towns that have it, and it is kind of, depending on which type of cap you have, it's either more severe or less severe.
Can I just ask a question that just got brought up? If the board decides to go with the advanced cap, in theory, we would only be renewing the existing licenses, and we would never be issuing a new license. Is that correct?
Yes.
Okay. So this is kind of a deciding point for the board. What cap do we want to, or do you want the language to reflect for August? Again, there's a couple of different ways you could go about this. Can I just confirm, Bonnie, the only city that does the advanced cap is Winthrop?
Hold on 1 minute, because I just heard from Lisa a little something that I didn't completely understand. So do you have them listed as one?
So I do have them. I didn't bring that one with me as well. I'm sorry. I brought, I think the two lists that I brought with me are the existing retailers near prior retailers list and the suspension numbers. So.
Okay.
So I will get that to you.
But I can get it to you.
Okay.
Yeah, and they did change it, but I'm not sure that it had the 30 days, like, it's just gone if you haven't renewed it by then. Maybe they did. That's what you meant, right?
Yeah, so it would be
Okay.
treated as a first-time applicant. So if
Yeah.
under the advanced cap you didn't, and if you had B and C, and somebody they failed to renew their permit within that 30 days, then they would have lost their permit to sell.
Right, okay. Okay, so at this point, I think we have to have the board decide if we want to do a basic cap or an advanced cap, which we will update the language and then bring before you in August.
Yeah, I mean, just obviously the advanced cap is a little more regulation, and I think at the end of the day, the role of these laws is to limit tobacco sales or make it as safe as possible, because we know the harms that tobacco use causes. The fact that there's another town that does use the advanced cap is reassuring to me. We just know that it's one other town in the 6 cities. Is that yeah.
And I don't know if they have the dual cap. That's what we're gonna check on.
Okay.
Okay.
I don't know, but I would doubt that they do. It's not that many that have adopted the dual cap. It's usually the more, maybe Brookline would be my guess of a place that has a dual cap.
Yeah, the only thing I worry about is just the pushback that we'll get as a result of that. I'm not sure from a legality perspective how that would work.
I mean, it is legal as far as it hasn't been overturned. We wouldn't include it if it wasn't unlegal. But yes, I mean, it is a stricter guideline. It is likely you would get more pushback from it than if you did the lower one. The more strict your regulations are, the more likely you're going to get pushback.
Sorry, go ahead.
I have a couple questions as I handle all of the tobacco licensing. So with that restriction of we wouldn't be handing out any additional tobacco licenses if they were dwindling. So if I bought your convenience store and they had a tobacco license, that would transfer to the new owner?
Yes.
Okay. But if I went across the street to lease the vacant storefront to put a convenience store in, I would not be able to obtain a tobacco license?
No.
Okay. What if I wanted to open my convenience store across the street in that vacant storefront, and I bought Sally's tobacco license from her, is that transferable to me at a different location?
I don't know the answer to that. I will be honest.
Okay.
Yes, I don't know the answer. That's the first time I've been asked that question. So I can get the answer for you. I'm sure DJ would know the answer. As I said, I just took over from him recently. So
Right,
I'm
because I mean,
still- yeah.
typically, tobacco licenses really don't have a lot of value to them.
Yeah, and this puts a lot more value on the
And this
license
puts,
itself.
this does put a lot more value
Yes.
to a license. So I didn't know if they were able to purchase that license from somebody to, to be able to open their business in a different part of the city or at a different location.
Yeah, and I will say that places that have done kind of the reducing cap, one thing that they've noticed is there are some towns where it's like they were way under their basic cap because people just weren't really renewing their licenses. And so they were like, this makes more sense for that town because in that town, there clearly isn't a huge market for tobacco products, and so they're not, store owners are not continuing to renew their licenses. And yes, it does have the impact of increasing the value of your license if you're in a place where that, where a tobacco license generates lots of revenue.
Okay.
And sorry, Mike, for the board, can you talk a little bit, do we have an existing wait list for permits? Are all 60 permits renewed every year? Can you talk a little bit about that?
Sure. Yeah, we do have a cap of 60 at this point. I think that went into effect maybe about 3 or 4 years ago where where the board did put a cap on that. And the number they came up with was 60 at the time. At one point, we did have a little bit of a wait list, but it was more for new businesses coming into the city. We currently do not have a wait list right now, and we probably have a couple available.
That's what I thought. I think we have about 57 now.
Yeah, we're at like 57.
So the other thing you could do is if you do the basic cap, you can just cap it at what you have right now. And a lot of towns would do that. So as opposed to having 60, just cap it at 57 in your regs. And then it makes it so that you're not getting more than you currently have, but you're not having this kind of reducing cap that may lead to, conflict down the road. But that's another thing that a lot of towns have done. You can always change that 60 number to whatever you want.
Thank you. So having heard all that, does the board have any thoughts?
Michael, I'm sorry, you said the existing cap is what, 57 right now?
We have 57-ish active licenses right now. The cap is 60.
Okay, all right.
Bonnie will know that number because she has to inspect them all.
I have to look it up, though. Every city's different.
I forget she has
But,
6
yeah.
cities. That's a lot.
I'll just say, this is a question for Michael on this one. What do you expect that if we do the advanced cap, that permit issue will get a little complicated in terms of buying permits from other people, or do you see that being a smooth process?
We have to, municipal inspection signs off on all transfers of businesses anyway. It should be pretty clean. It's not like we don't have a lot of sales of the businesses. So we can work with that within the, license commissioner for change of managers and stuff like that. So I don't see it being too complicated. I can see it, businesses not coming to the city. If that's one of the questions they should ask when they come. Sometimes they just assume that we have them, and then when we did have the waiting list, they were kind of like a little shocked that we didn't have them, because first of all, they get a license from the Department of Revenue through the state. So they think that because they have that piece of paper from the Department of Revenue, that they're good to go. Then a lot of times they're not aware of the licensing procedures within the municipality. So that's where it becomes a little more complicated.
I will also say this is one where your retailers will generally like this because it makes their licenses more valuable. So the pushback you'll get from retailers it has not been as strong in other places that have had the reducing cap, because it just is, for them, it means that you're gonna have less retailers. So they tend to be a little more friendly to that one.
Yes.
Honestly, I don't see a lot more convenience stores coming into the city. You know, the larger retailers obviously don't sell tobacco products, but it's more the mom and pop, corner stores that are the tobacco retailers.
So, just coming from my perspective as a physician, I'd probably, before the reduced in the advanced cap, I think that any way we can limit tobacco sales is the goal. Obviously, we can't get rid of it. That's not the point, but eliminate and the supply and if we can do it legally, great. So that's my vote, but I know that Craig and Neza, you may have other vote.
Yeah, I think for me, I'm leaning strongly towards advanced myself. Just like you said, Dr. Bunker said, I mean, any way we can minimize the sales to teenagers. And like if we can, like Bonnie said, if we can limit, like instead 60, lower it to 57, which what we have right now, then we don't have to worry about 3 people come in and apply for the remaining 3. It'll be okay. I mean, if that's legal and we can do it, that's my vote also.
I agree myself with the advanced, coming from a dentist's perspective, and seeing an increase lately of oral carcinomas, I would lend towards that as well.
Okay, great. So the language for the advanced capped will be included in August, and if you choose to vote at that time, you know, that gives you a month to think about it as well, and we can reassess in August, but that language will be in the document in August. Okay. Moving on to page 11. The next section in green is section E, a tobacco product sales permit shall not be issued to any new applicant for a retail location within 500 feet of a retailer with a valid tobacco product sales permit as measured by a straight line from the nearest point of the property line of the retailer with the valid tobacco product sales permit to the nearest point of the property line of the site of the applicant's business premises. Again, this is a new section, and correct me if I'm wrong, but this is again aligning us with existing regulations to make it easy to regulate, correct?
Lauren, did we, I have that we had on C, on page 10, that we wanted to talk about, did we want to limit the amount of permits that could go to an adult-only retail store, or has that already been covered?
Oh.
No? Do we have that?
Yes, we do need to talk about the
Okay,
adult. That
sorry.
was, I think, yeah, something strange happened in there. The two,
Okay, yeah, it looks like it.
it looks like one got removed, the reducing cap. It
Okay.
was my mistake. It was removed for
So
the.
we essentially need a section, it will turn into section B, because section B will be section A.
Yes.
Because we're taking out section A. So section C is of the permits allowed pursuant to section 11 above, there shall be no more than X number of tobacco sales permits issued to adult-only tobacco retail stores. What is the current number of tobacco-only retail permits that we have?
I think it's 2, but I'll have to get back to you. I think you have 2.
Okay, so for the board, the existing number of tobacco retail permits that we have will be reflected in August with the current number that we have. Is that agreeable?
Yes.
Okay. Okay.
Yes, it is.
So the retail location, that's just a density thing. We've done some studies on density, and it shows that some neighborhoods, that's for E on page 11. So I just wanted to, because I did want to, Lauren, it's not standard. So I have which other towns have done this. I can hand it out to people, the list of towns that have adopted these types
Okay.
of regulations.
And so, sorry, we're jumping around a little bit, guys. Sorry about that. But just to be clear, so I'm going to put the advanced cap language in. We're going to also put in a cap on the number of adult-only tobacco retail stores, which is reflective of the current number of permits that we have. And then I just want to confirm, we are not going to do the permit renewal cap, which would essentially, someone who didn't renew their permit would bump them to a first timer, which is the language that is kind of called like the dual cap. Am I getting that all right, Lisa?
I think so. As I said, there's only
Yeah.
one town, I think, that has a double
Right.
cap, so I'm not 100% an expert on it.
Okay. So can I confirm with the board that that language will not be in August, where it reflects that if you don't renew within 30 days, you will be essentially considered a first-time applicant, which could potentially risk your license? That language, do you want that included?
So
I-
we're, oh. Go ahead, Neza.
I'm sorry, I was just saying, yes, Lauren, I think it should be included. Thank you.
For both adult-only retail stores or for all tobacco stores?
So just to be clear to the board, this is essentially a higher regulatory burden where we're going to be put the language in where we will have a reducing cap. We're going to be then also saying that if you don't renew your license within 30 days of expiration, you will be essentially kicked out of the current the current renewal process, and you will essentially, if an advance cap happens and the language for the renewal process happens, if you don't renew, you are out of a license. Is everyone understanding that?
You are likely to get pushback on this one.
Yeah, so I think I obviously, I think the advanced in itself is quite a regulation. I hear you, Neza, I hear you in terms of ideally that would be the case, but I feel like it may be a little bit too much and maybe something in the future we can talk about. But I think for now, kind of doing one step at a time. I don't know. Please, anyone, if it has
We
anyone-
typically don't have an issue with the renewal process. Every once in a while, you get a late straggler, but, ours is all electronic. We send it out electronically, so they do receive it via email. It's not, we do charge late fees if they're, that they are late. But we start the renewal process for the December 31st expiration. We start that renewal process, mid-November, early November. So they have plenty of time and plenty of advance notice, as we approach the expiration date, so.
Because I was going to ask if they're reminded, are they reminded?
They get plenty of reminders, and then they get late notices, typically, after December 31st, mid-January, we start sending late notices as well, so. And if we have to make a visit to that establishment as well to get them to renew, then we do that as well, so it's typically not a non-issue.
All right, that's actually helpful. I didn't realize it was not much of an administrative burden that you're already doing that. So Neza, I'm sorry if I put down your point. It sounds like doing the permit. Can we just keep that language on the dual, I guess is what we're saying, if that's okay? It sounds like it's not as hard a process and.
Yeah, sure, yes, we'll include that in the voting in August. Okay. Sorry, going back to the distance of 500 feet. Lisa, do you want to talk about that a little bit? Density issues?
Yeah, so I am not 100% sure how this actually interacts with the dual cap, or with the, not the dual cap, with the advanced cap. Because it applies to new, so it wouldn't shut down existing retailers, it applies to new retailers. So I think it might not be as applicable, honestly, if you pick the advanced cap, because it's a different, it basically says that you can't open a store within 500 feet of an existing retailer, but if you're already capping the number of new retailers, it's not going to be applicable, so we can take it out.
Okay, perfect. Okay, so that because it's not applicable with an advanced cap, that language will not be reflected in August. Okay. Can I just for my understanding too, the next section that's highlighted in green, permits for adult-only tobacco retail stores will only be issued if one is available pursuant to section above. There's nothing really to decide on there, correct?
It's just you decide whether or not you adopt section
Right.
11C. So if you guys, and since it'll also be 11B, so we'll have to change, obviously, the numbers
The
around
numbers,
and things
right,
like that. That'll
okay.
be reflected in the final.
Perfect. The next section is an application for transfer of a tobacco product sales permit to a new owner for the sale of tobacco products from an existing location with a valid tobacco product sales permit will not be denied solely on the basis of the quota set forth in this section, provided, however, that such an application will be treated as a new application in all other respects. If the permit transfer application is not received within said 60 days of the transfer of the business, the permit will be deemed surrendered. I believe this is addressing the point that Mike made earlier. Is that right?
Yes, it's also saying like they would have to get their own DOR permit and they'd have to do, before you transfer, I think it has to do with like fees. So you would have to, any existing fines or fees would have to be handled. That's the new permit part. You would have to pay those before you can transfer the permit, but it wouldn't, the things that are in here wouldn't prevent one from being transferred. But say if somebody had like an existing fine for sale to a minor, they couldn't just do a transfer of sale because you have to pay those fines before you can do a transfer.
Okay.
Does this go back to what Mike was saying about, so could a store sell their permit to another?
And that's the part I don't know the answer to, so I'll have to look that up.
That'd be-
Okay. So that language will be reflected in the next, the revised regulations that you'll see next month. The next section, prohibition of smoking bars. Smoking bars are prohibited in the city of Revere. Bonnie, do you want to step up to the mic a little bit? And did you get any information on this section?
No. Well, this is, maybe you would answer this better, Lisa, but my understanding is that Revere already has a smoking bar restriction, so you can't open a smoking bar. But some of what this law was written for was that people, well, do you know, Lisa? This one's a
If you guys
complicated
already
one.
have a smoking bar restriction, it is probably in green because I missed that,
Okay.
to be
So we
honest.
don't need to
Perfect.
do
If
anything
it's
about
already
it?
in existence, then it's probably just oversight on my part.
Oh.
And just to clarify, the ban on smoking bars exists in the other tobacco regulations for the city, the workplace safety regulations.
Okay, so that would be why it's in green, yes. So it's adding it to these regulations, just so that it's in two places. It's just to clarify, redundancy doesn't make regulations bad.
Okay.
So it's, one of the things that this document aims to do is have as much information for retailers as they can.
Got it.
Here.
Okay. Okay, so we're moving on to section G, which talks about, cigar sales. The regulation, so part one, no person shall sell or distribute or cause to be sold or distributed a single cigar unless such cigar is priced for retail sale at $2.90 or more. The difference here is that in our old regulations, it was at a lower price point.
So right now this is the price point yours is at. It can be raised too. So a lot of towns have been raising theirs, because the number with the consumer price index has changed.
Oh,
So the one
sorry
that,
about
yeah.
that.
So the
Okay.
one that's here is because we weren't sure if we could change it. That was the issue, because there was that judgment. So that's why it's reflected as 290, but you can raise it.
Okay.
That's what your city solicitor said, correct?
Right, okay, so this, again, just going back to the very beginning of this conversation, the last time these regulations were implemented, when a specific retailer brought a lawsuit against the city, the two things that kind of got pulled out or, kind of got talked about in that lawsuit were blunt wraps and cigar sales. So when I talked to the city solicitor about changing the regulations about our cigar sales, he believes that we are able to make changes to price points of cigar sales that we can make those changes without that lawsuit kind of being prohibitive in making those changes, just for your knowledge.
And you were correct, this is actually the updated price. So in the last one, it was, in the agreement, it was pegged at $250. But again, you talked to the city solicitor, and he said he's happy to.
And can I just confirm, is $290 kind of standard for, okay, that is standard, okay.
Yeah, I think I would say the majority of towns that have regulations have $290.
Okay.
Boston did the math to figure out what the update was from the $250, and that's where we got the $290. It's just pegged to the consumer price index.
Okay.
It's just keeping it with inflation.
Unless there's any objection, that language will be included in August. Okay. Part 2, we're now on page 12. Again, this is talking about cigar sales, but not individual. This is talking about no person shall sell or distribute or cause to be sold or distributed any originally factory wrap package of 2 or more cigars, unless such package is priced for the retail sale at $5.80. I'm assuming, again, this is a consumer price index, and that is what this number is reflective of, correct? Yes. Okay. Unless there's any objections, that will stay in for August. Okay, moving on. Section 3, can I just confirm, Lisa, does this wording need to be included if the previous wording is in place?
So you can include it. It's basically just that you can't sell them individually for less money. But we can remove it because I don't think it's necessary.
Okay. Okay, so we're going to move on to section H, again, on page 12. Bonnie talked me through this one. Our previous regulations do not specify the 3 words that are highlighted. I'm going to read it out. No person shall possess, hold, keep, sell, or distribute, or cause to be possessed, held, kept, or sold or distributed any flavored tobacco product, and the paragraph goes on. She explained to me that since the new flavored tobacco product laws came into place, many retailers are holding on to those flavored products and saying that they're not selling them, but they're holding on to them and displaying them. Bonnie, do you want to elaborate?
The most common thing I've heard is that they're holding them for the distributor to take them back. So in other words, they want the distributor to return their money and take the product back. So this does away with that. You know, when I go into a store and I find these products under shelves or in back rooms or so on, this says you cannot have them there at all. They need to be gone.
And unless there's any objection, we will keep that language in for August. Okay. Moving on to the last highlighted section on page 12. If you remember when we talked at the very beginning, we talked about the definition for blunt wraps. This is now where you would see the regulation for blunt wraps. And it basically states no person or entity shall sell or distribute blunt wraps in Revere. I just need a decision from the board. Is this language going to stay in, or are we taking this section on blunt wraps out?
My feeling is to keep it in, and we can vote on it next month.
I would agree, keep it in.
Yeah, me too. Just keep it in. Thank you.
Okay, great, thank you. All right, so we're moving on to page 13. We are moving through here, guys. Sorry about that. The 2 highlighted sections on page 13 specifically talk about discounted sales of tobacco products, or like a 2-for-1 deal, and the fact that they're not allowed. You cannot have a sale on tobacco products. You cannot have a discount on tobacco products. You cannot say 2-for-1, you know, anything like that is not allowed. That's what this language states. If we keep it in, unless there's any objection, we will keep this language in to be decided in August. Agreed? Okay. Moving on to page 14. Here's where we begin talking about the violations. Some of this language you have already decided upon, but we need to codify it in our new language, and we need to make some specific distinctions. So I'm going to start with our first violation, which you cannot change the fact that a first violation will be a $1,000 fine. What the Board of Health has to decide on is how long the suspension of the permit will be and if it will be in consecutive days. Previously, you had decided that you would adopt a 3-day suspension, but we didn't specifically state a consecutive day. So I'm asking the board to specify Do you want to continue with a 3-day suspension for a first violation, and do you want it to be in consecutive business days?
I'm just going to say yes, consecutive business days. I'm glad we're able to clarify that today. 3 days, yes, 3 consecutive days, sorry.
Now,
So-
hadn't we said before that it didn't have to be 3 consecutive?
We said it because we didn't, at least this is my understanding, and please correct me.
Yeah.
We hadn't specified if it needed to be consecutive. So in that circumstance, but do you feel that non-consecutive?
Yeah, I'm not certain myself, but I would probably go with 3 consecutive then,
Okay, all right.
yeah.
Me too. I think 3 consecutive with $1,000 sounds right.
Yeah, and Bonnie can actually talk, the process of doing the suspension is a little bit complicated, so having them consecutive days makes it easier.
Okay.
I just want to refresh your memory that it was, so this would apply to tobacco retailers too, of which I think you only have 2, adult-only tobacco retailers, but so that would mean no sales of any tobacco products for those 3 consecutive days.
Correct. And you can imagine for an adult-only tobacco seller whose only business is tobacco, a 3 consecutive business day suspension is much more significant than a retailer who sells other things, and tobacco is just one of the things they sell. However, unless I'm mistaken, we cannot and should not we should not make the distinction. It should be a fine that for all permits, any violations have to abide by these rules.
This applies just to sale to minors, so for this suspension. So I just want to clarify that. So this is, and I would say that's probably one of the more egregious. And the state made a decision, obviously, that's why the fine structure is so high. It's a huge increase for most towns. I don't think there were any towns anywhere close to what the current fine structure is. That is what the state decided on. So yes, it is significant. It's also, again, one of the violations that's considered more serious under the state law.
Okay, great. So I'm going to be putting in 3 consecutive business days for your review in August. And just one more thing before we move on to the second and third fine. The last part of this paragraph, and I just want Lisa just to confirm this. So we have stated now that there will be a fine of $1,000 for 3 consecutive business days. And then the second part says, and a suspension for violations of other policies listed in MGL Chapter 270, Section 6, shall/may be suspended for XX consecutive business days. Can you clarify what that means?
Yeah, so that is for the regulations that are not covered, or aren't covered under the state law or aren't within that, the violations. The state law outlines specific violations for sale to a minor that have this higher fine structure. So there's actually this chart right here which will show the 2 different types. So the ones that are subject to state law are on, I don't know my right from my left clearly, on the left, and the ones that would be local regulations. So that is, so these things, you can pick a lower number of days. Again, because of the state law, you can say those are considered less serious on the state level of violations.
So the board will essentially will have to pick a number of days for a first violation of things other than the left. Can I ask if, okay, sorry.
Or
go
you
ahead.
can pick no suspension for those violations as
Okay.
well.
Do you have any idea what other cities or towns do for this?
I don't think most of them do a suspension for the first violation.
There are 1 or 2 I know, but I don't know who they are.
Okay.
That adopted it to be the same.
So it sounds like either towns there's no suspension, there's still a fine,
For the other violations.
right, for the other violations.
You're required under state law to have some suspension for the sale of a minor. So that's where you can pick again, we recommend people pick a number just because it's easier. And then for the things that are just local regulations, you can pick any violations you want. So you can choose no suspension, or you can choose a suspension if you would like one.
Right. Sorry, guys, I know this is complicated, but just so you all understand, the sale to the minor, the kind of egregious state laws, that's the $1,000 and the 3-day fine. There are other fines that businesses could get that are kind of like local regulations. If you look to the bottom of page 15, it's the section to the right. Those have a lesser fine. They're not the $1,000 fine, they're a lesser fine, which are specified in some of the non-highlighted section. I think it's $300. But you can also decide if you want a suspension of a permit or not. And that's what you would have to have me put in for August, for a lesser local regulation fine.
And you have existing ones right now. So right now, for those lesser fines, it's 0 for first, 7 for second, and 30 for the third.
Would you like to keep what's in the existing regulations?
My vote would be to keep what's in the existing regulations, but please let me know if you feel otherwise.
I vote the same.
Yeah, I vote the same too, keep the existing ones.
Okay, great. So let's move on to, in the case of a second violation, again, there's not much leeway. You can't change that, the fact that everyone would get a $2,000 fine. Again, this is for the state law fines, sale to a minor, that kind of thing. You cannot change the fact that they would be fined $2,000. I'm going to make a judgment call that that we're going to be putting in the word shall and not may. If you disagree with that, please let me know. But we are going to be saying that in a second violation, they will be fined $2,000, and they shall be suspended. And here's where you have to decide if you want them suspended for 7 days or for 30 days. Again, this would be consecutive business days. I'm assuming that most people go with 7 days. Is that correct? Most municipalities do 7 days.
Yes.
Okay. Would you like to reflect 7 days?
Yes.
Okay. Okay.
Yeah, 7 is good.
Perfect.
That's fine.
And then, again, we're moving on. For the third violation, we cannot change the fact that they would get a $5,000 fine, but we are going to be putting into our regulations that they shall be suspended for, again, here you have to pick 30 or 60. I'm assuming most people do 30. Is that correct?
I think most actually leave in the 30 or 60 language.
Okay.
But you can definitely pick one. But again, so this law went into effect in 2019. You guys got a little bit unlucky because you updated your regs, and then I think a couple months later, the state law came out, which had a lot of changes. So there's a bit of lag time between updating regs. And because this is such a big change, I think my November is very, very busy updating this particular language. So at this point, most people just have the 30 or 60. You guys could be a trendsetter with what you pick.
So if I'm understanding correctly, if we leave in 30 or 60, if any business had 3 fines, the board would then decide if they are going to give that business a 30-day suspension or a 60-day suspension, depending on what the situation is. Would you like the language with 30 or 60?
Can it be like between 30 to 60 and we decide in between, or it has to be 30 or 60?
What I'm hearing is you can keep it as the language that you would decide at the time of the fine if you want 30 days or 60 days. You don't have to decide now. If you keep the language in that is reflected in the current wording, you can be suspended for 30 or 60 days.
Go. Please, Neza, go.
I'm sorry. Yeah, I think we should keep it the way it is right now.
Okay.
And we decide when we get to that point.
I agree. Sounds good.
I agree as well.
Okay. We're moving on to page 16. We're so close. Permit suspensions and permit revocations are calculated using the total number of a retailer's violations, combining those violations that receive a single state mandated fine and those that receive local fines. Where there is a difference in permit suspension periods, the longer period shall apply. Can I just confirm that this is just making the language clear with other cities? Is that correct?
No. So what it would do is if you violated a local fine and then you later violated one of the higher state fines, that would still count as your second violation.
Okay, and do most cities and towns adopt this regulation?
Again, the ones that have updated their regulations have, but it is a small number at this point. So I'm not like comfortable being like the majority of cities and towns are using this system.
Okay.
I think there's a reason why this language is there, and we should adopt this, even though it is a more severe penalty, because you can get the local regulation. I think we should adopt this as well. But please, if anyone has a different thought process.
I'd agree.
Yeah, I agree too with you, Dr. Bunker.
Okay. So in August, that language will be included. And then the next section, in the case of 4 violations or repeated egregious violations of any section of this regulation, as determined by the Board of Health within a 36-month period, the Board of Health shall hold a hearing in accordance with this regulation, and after such hearing, may permanently revoke a tobacco sales license. Are we in agreement that this will stay in for August?
Yes.
Okay.
Yes.
Yes.
Okay, the last highlighted section of page 16, multiple tobacco product sales permit suspensions shall not be served concurrently. Can you clarify what that?
Yeah, so basically, if you were to, if someone were to be found in multiple violations, they couldn't, and they had 30 days for sale to a minor, and then they also had, possession of blunt wraps. They couldn't just put because that's the smaller number of days, they couldn't just kind of like stack them if they were separate violations.
Okay, great. So unless there's any objection, that will be in August. Okay. Last page, page 17, first highlighted section, for purposes of such fines, the Board of Health shall make the determination notwithstanding any separate criminal or non-criminal proceedings brought in court hereunder or under the Massachusetts general laws for the same offense. Can you clarify what that means, Lisa?
So you have the authority to do non-criminal disposition within the Board of Health. That's allowed under Massachusetts state law. This is just clarifying that you would have this authority.
Okay.
I think under state law, you have to basically assert the authority.
Okay. So unless there's any objections, that will be in August. Next section, each day or portion thereof shall constitute a separate offense. Sorry, I'm going to start with the beginning. Each day a violation exists shall be deemed a separate offense. Each day or portion thereof shall constitute a separate offense. If more than one, each condition violated shall constitute a separate offense. Yeah. Unless there's any objection, that will be in August. Okay. Last section, the Board of Health may enforce these regulations or enjoin violations thereof through any lawful process, and the election of one remedy by the Board of Health shall not preclude enforcement through any other lawful means. I think this is just legal language that we need to incorrect. Okay, great. Thank you so much. We made that through. So sorry that took so long. Any other concerns about these specific regulations before we move on to our, you know what? There's one more thing. I'm so sorry. Because this is a public hearing, I have to let you know that there were some residents who voiced their support over email. I'm going to just read them. The names, John Rizzo, JJR609@gmail.com, expressed support for the adoption of the proposed model regulations that will further protect our children from these harms. Susan Luongo @outlook.com, also sent an email. I wish to support the board's adoption of the proposed model regulations. Stacy Rizzo, S. Rizzo @Revere K-12, also sent an email. I wish to support the board's adoption of the proposed model regulations. Anna, her email is pachdue@yahoo.com. She also supports the board adoption of the model regulations. Justin, SMIMI @msn.com, also supports. These were all emails. Viviana Catano Moreno at mgh.harvard.edu also supports adopting. Please vote in favor of any regulations that would protect the health of our residents. These policy changes are very important and impact the health of the community. Finally, Fatu61 also supports the board's adoption of the model regulations. Policy changes like these have a tremendous impact on the health of Revere residents to come. There were hold on, 1, 2, 3, 4, 5, 6. That was like 7 in support, no emails not in support of adopting model regulations. Sorry, I just had to read those because it's the law. Okay. Any other things that have to? Okay. So this is the final thing for the tobacco regulations, and then we have one more licensing that will take 2 seconds. Anything else? Okay. Okay.
Actually, I would just like, as a board, to thank everyone that supported, and we treasure the feedback.
Great, thank you so much. So we have 2 body art licenses that need to be voted on. I'm just going to read you quickly. where this is a individual license and a establishment license of the same applicants. Our applicant is Tao Nguyen. She submitted her application for her individual practitioner license on April 11th. We did her inspection on July 6th. She passed. The Public Health and the Inspectional Department recommend that you approve her license. Can the board vote on that?
I'm going to vote yes, I approve.
I vote yes, I approve also.
Yes, I approve.
It's going to be a yes from the board.
Sorry. And then the establishment permit also submitted by Tao Nguyen. Her establishment is called the Brow Chemist. Her submission date was April 22nd. Her inspection date was July 3rd. Again, she passed. We recommend that you approve her license.
Yes, I approve.
Yes, I approve.
Yes, I approve.
Okay, great. That's the final, I think, item for today.
Excellent. Thank you. So that will conclude this month's Board of Health meeting.
Yeah. Thank
Thank
you,
you, everyone.
everyone.